Hello, everyone. Thank you for joining us tonight. I'm very excited to um, be here tonight and start the kidney disease class series. This is the third consecutive year that actually we've been offering this class, and we change a little bit the format each time. So we'll see how much you like this format this year. Today is actually the first class in this pre-series, and we're going to actually be able to focus more. It's going to be a little bit less nutrition focus. We're going to just take the time to talk more about the basic kidney function, understand how kidneys work, the difference between the acute and chronic kidney disease. We're going to discuss stages of kidney diseases, the kidney disease, and risk factors. Also, I'm going to include a healthy diet recommendation overview. So it's going to be a little bit of a talk about nutrition, but definitely next week in the second class, we're going to dig deeper into the nutrition therapy of chronic kidney disease and be very specific with recommendations. Today also, I'm going to actually talk about complications of CKD. And so next week, as I said, it's going to be a much more about nutrition therapy. And the third and the last class would be more practical tips of how to implement those recommendations from class number 2. So we're going to talk about how to make those changes, meal planning tips. We also, the last half an hour, we're going to have a cooking demonstration, a recorded video presented by a chef that specializes in chronic kidney disease cooking. The second class also, I forgot to mention, I apologize for that. We're going to have the last half an hour like breakup rooms, so smaller groups that people can ask more one-on-one questions. We're going to have that registered dietitians being part of those groups, and hopefully we'll be able to address more of your individualized questions. But today it's going to be just a presentation, so no other activity. I will make my I'll do my best to actually finish on time with the slides, so we have room for questions at the end. My goal for today is actually to be able to be very clear in what I'm talking about, to explain those concepts in a way that's easy to understand. Please feel free to write us in the chat room or raise your hand if you have questions or you don't understand, or you can follow the information that's presented to you. And we're gonna get started actually with how the kidneys work. So the kidneys are two organs that are bean-shaped and they're kind of located below the rib cage. A lot of people refer to them more in the lower back. They have an amazing filtering capacity, and there are amazing organs. When you think about, they filtrate 120 to 150 quarts of blood, and out of that, they actually filter 1 to 2 quarts of urine. That urine includes waste and extra fluid that our body doesn't need to build up in the bloodstream. And daily, they do that kind of work. So think about, you filtrate about 150 quarts of blood to produce just 1 or 2 quarts of urine. So the power of filtration, it's really impressive. And I have this picture here that if you can follow my arrow. So this red it's kind of how the blood, where the blood enters from your body, enters the kidneys. This is the kidney artery. And then the blood kind of goes inside the kidney. And inside those kidneys, each kidney will have about 1 to 1.3 million nephrons. And those nephrons are very specialized cells that I have a picture here. So in each individual nephron, you have a glomerulus, which is this capsule of very, very dense capillaries, which are tiny, tiny blood vessels. And then the blood flows through, and then this is where filtration happens. So think about this as a very dense sieve that will filtrate your blood. So whatever it's not needed by your body will be turned into urine and move through those tubules and move through the ureter. And each kidney here, you could see it has a ureter, and those actually meet into the bladder where the urine is stored until we actually need to get rid of it. When it gets full, then we need to eliminate the urine out of our body. So the rest of the blood that doesn't need to be eliminated after the filtration, all the other good nutrients that our body needs to reabsorb, we're gonna return back to the blood through this, what is here, a blue vein. So filtered blood will return to your body through the renal vein back at the heart, and the cycle will start again. The heart will pump back this oxygenated blood through the red artery, renal artery. So this is kind of a process that happens obviously a lot of times in a day, and your kidneys will filter about 100, as I said, about 150 quarts of blood every day. So this is how they work. And I kind of described half of the slide is kind of what I just said. And the other half is like, okay, besides the filtration that happens and the help with removing the waste and the extra fluid from our body, what are the things our kidneys doing? And well, it keeps the blood composition stable. It keeps the balance of electrolytes, sodium, potassium, phosphorus. Those are electrolytes that are managed by our kidneys. So if we eat too many foods with potassium or phosphate, sodium, our kidneys will regulate that and will keep as needed in your blood, and will eliminate the rest in our urine. That's why actually when the kidneys start failing, those become some minerals of concern, because the kidneys are not filtering them very well, and they can accumulate in your blood, and then you increase levels in your blood of those particular electrolytes, which can cause some health issues. So besides the blood composition stable and the balance of electrolytes, our kidneys actually, they're making hormones that are involved in blood pressure. Specifically, it secretes renin, which is an enzyme, and that actually secretes more hormones that will be able to regulate your blood pressure. Also, the kidneys are making hormone that it's involved in red blood cell production, erythropoietin. So this particular hormone will actually tell your body how many red blood cells to make. And we recycle red blood cells every 3 or 4 months. We make new ones. So it's very important to have adequate hormone to kind of tell your body, create more red blood cells. Also, one of the last role of kidneys is the fact that it activates the vitamin D in our body. And vitamin D is needed for calcium absorption. So in order for us to absorb the calcium we're eating, we need to have adequate vitamin D in our blood. And you'll see how that when your kidneys are failing, the fact that the vitamin D is not activated and you might not absorb enough calcium can actually increase the risk of bone disease. There are 2 kinds of kidney disease, as I mentioned. So acute kidney disease, that basically this is completely reversible, right? So it can happen all of a sudden, and with early detection and appropriate treatment, it can cure your kidneys, and your kidney function can recover completely. This sometimes happens when, there's a toxin that affects your body or your kidneys, or a medication can trigger that. There are different ways when that can happen. We call it acute kidney injury or acute kidney disease. And again, after you get the proper treatment, your kidneys actually recover, and the kidney function is back to your baseline. The chronic kidney disease, it's more a kidney damage that unfortunately cannot be reversed, but can happen usually more gradually and progressively. Definitely can be managed and can be slowed down with diet modifications. So the progression, and this is what I want to make it clear, the role of nutrition therapy in managing chronic kidney disease is to really slow down the progression of decreased kidney function. I've had few patients that they were able to recover their and improve their GFR, that glomerular filtration rate, and I'll talk more about it in the next slides. But it's not going to be a complete, like from maybe a GFR of 30, you're going to go to a GFR of 90 or 100. It's more maybe from a GFR of 35 with diet modification, appropriate treatment, and better management, you might get a GFR of 45. So improve a little bit, but the idea is to keep it where it is and slow down stop or slow down the progression of decreased kidney function. So I wanted to kind of make it clear because sometimes people don't understand that. And also, I think that was, there were a couple of people asking this question in the questions that we actually received prior to presentation. How do we detect kidney disease? How are we aware of having this? It was a slide that Twin showed at the beginning that basically a lot of people don't know they have chronic kidney disease, a vast majority, which is in a way sad. But there are two ways, you know, we have a blood test, we have a urine test. With the blood test, we look at the blood creatinine level, and usually that gets higher as you start having some decreased kidney function. And we look at the glomerular filtration rate, GFR, which usually decreases as kidney function deteriorates. And remember, the glomerulus, it was that capsule that's where actually the sieve, where you filter through the glomerulus, we filter all that blood. So when that filtration rate slows down, that GFR is, you know, just think about your kidney is just slower at filtering the blood and not as effective. The urine test, well, it usually tests for protein and or blood in the urine. And usually a normal healthy kidney should not have protein in the urine. And when we have, so this is a simple test that can be done. And when protein is present in the urine, even with the normal GFR, that can indicate that that person is an increased risk of CKD. So it's very important, especially for those at risk. And those usually are people with diabetes. So if you have diabetes and if you're not doing annual urine test for your protein with your doctor, just talk with your doctor about it, because this is an easy way to kind of early detect chronic kidney disease. Again, that that protein in the urine appears even before the GFR starts dropping. So that's very important. Symptoms of CKD, we don't have that many symptoms. Most people actually don't have any symptoms. They might have symptoms when actually the CKD is more advanced, maybe stages 4 or even 5. So that's another important thing, that monitoring and doing regular labs is very important. However, as I said, a lot of people don't have symptoms, but especially more advanced cases will have things like feeling more tired, not having energy, having trouble sleeping, concentrating, not having a great appetite. Muscle cramps at night are common too, swollen feet and ankles, and I'll talk about complications of CKD, edema and fluid buildup can happen. Puffiness around your eyes, especially in the morning, dry and itchy skin, and also the need to urinate more often, especially at night. So those can be all symptoms of CKD. So as I said, CKD, it's a gradual progressive loss of kidney function over time. It's called a silent killer because often does not have any symptoms in the early stages. And I want to mention that high blood pressure and diabetes are the main causes of CKD. Not the only causes, but the main ones. And almost about half of individuals CKD also have diabetes and or self-reported cardiovascular disease. Why it happens, like we all know that uncontrolled, and I want to mention high blood pressure and diabetes. Well, the key word is here, poorly managed diabetes and poorly managed blood pressure. So it's very important if you have those conditions. I don't want anybody to feel like, oh, I have diabetes and high blood pressure, I'm going to get CKD no matter what. So the main key here is to control your blood pressure and your blood sugar as well as possible, because what happens if diabetes is uncontrolled and blood sugar is too high, we know that that can affect actually your vessels, large vessels. That's why diabetes increases the risk of heart disease and, for example, heart attacks. It can affect those larger coronary arteries in your heart, but also can affect the tiny, small vessels, like those capillaries that you saw that were part of that glomerulus, the sieve. So by doing that, it's almost like I think of that analogy, and I'm not sure if it's necessarily the most accurate, but when you have diabetes uncontrolled, it will affect those small vessels, or high blood pressure that's running through those small vessels, they can pop, and then you're going to have holes in your sieves. And then you're not going to filter very well that blood. So high blood pressure and diabetes, definitely, they're the main causes of CKD. Other causes will include glomerulonephritis, which is kind of a inflammation of the glomerulus, inherited diseases like polycystic kidney disease or lupus, obstructions caused by kidney stones. So we'll see that kidney stones can increase the risk of CKD, especially when they cause the obstruction. So not just kind of having the kidney stones, more that the obstructions and the injury that can happen inside the kidney when you have a kidney stone. Tumors, enlarged prostate gland in men, and kind of these recurrent urinary tract infections. Those can also increase risk of CKD. Risk factors, we have the controllable ones and the non-controllable. So diabetes, high blood pressure, heart disease, obesity, those are all controllable. The non-controllable will be a family history, age over 60, and race. Certain races are higher risk than others, but and also with age, obviously, just in general, organ functions will start decreasing, and that's the case with the kidneys too. Blood sugar control, again, this is one of the most important thing. If you have diabetes, this is how you want to take care of your kidneys. You manage your blood sugar. And how do you do that? You take the medication as prescribed, you monitor as directed. You might need to monitor blood sugar at home or do very regular labs with your physician. You eat regularly, you kind of eat every 4 hours or so. So you might have main meals and maybe 1 or 2 snacks, depending on what's needed to maintain that eat every 4 hours type of schedule. You want to balance your carbohydrates with protein and fats and fiber, because when you do that, you slow down the absorption of sugar in your blood. So that carbohydrate that will turn into sugar when you break it down with your digestion, if you have it with the protein and fats, you will slow down the absorption of it. So instead of spiking your blood sugar after you ate something, the blood sugar will slowly go in time like a nice curve. So for example, even a piece of fruit that's a healthy carbohydrate with fiber, instead of having just a piece of fruit by itself, I would say have a piece of fruit with a handful of nuts, because that will add extra fiber, some protein, and some healthy fat that will balance that carbohydrate in the fruit. Choose whole grains when possible, because then these digest slower and minimize the blood sugar spikes because of the fiber. So the fiber, remember I said, is the protein and fat, will slow down the absorption of sugar. So we recommend at least half of your grains to be whole grains in a day, because I know sometimes it's impossible to choose everything 100% whole grain. Limit refined carbohydrates and simple sugars. Obviously, simple sugars are the ones that they don't need any chemical digestions. They're sugars already, so they're just going to cross from your intestines into your bloodstream in a matter of like maybe 30 minutes. My classic example is like if you drink a juice or a soda that's basically no fiber, no carbohydrate, no fat, and it's a simple sugar, regardless if that fruit juice is natural or not, regardless if, let's say, just squeeze some orange juice from fresh oranges, it is still a concentrated form of sugar, even if it's a natural form. And that will, in a matter of less than 30 minutes, all of it will be available in your blood. So there's no buffer, there's no way to slow down that spike in your blood sugar. Exercise regularly. Each time we contract our muscles, our body, our muscle cells will have the ability to drag sugar from your blood inside that muscle cell. So it's a nice way to lower your blood sugar when you exercise. And you don't need the insulin, that hormone that facilitates the, usually the insulin, it's like a key. It's a hormone that facilitates the entrance of the sugar from the blood into the cell to fuel it. When you exercise, the muscle cells have the ability to not depend on that hormone. So they're just kind of dragging all that sugar inside the muscle cells to fuel it. Control the amount of carbohydrate consumed in each meal and spread them evenly throughout the day. I have a lot of people with diabetes that I work with that they think that having diabetes means no carbs, you can't touch any carbs. It's not true. It's actually good to eat carbs, but more complex, high fiber carbs. And it's important to not eat too many carbs in one sitting. And all the carbs you're eating in a day, spread them evenly every 4 hours throughout the day. So you're not getting the spikes, you're just getting a nice wavy, curvy type of pattern. Blood pressure. With blood pressure, the goal is to have less than 130/80. How do we manage the blood pressure? Well, again, we need to take the medications as prescribed. We check it regularly. There are devices that people, can actually use at home and check it regularly. That's helpful to know if there are certain times of the days that you get spikes or lows. Exercise regularly. Again, the blood pressure is very directly correlated with exercise. So when people exercise, the blood pressure actually drops. And manage stress. We know stress can increase blood pressure. And in terms of nutrition diet recommendations, definitely reducing sodium helps, because sodium, when we eat a lot of sodium, our body likes to hold on to the water. And then that will actually increase the blood volume. And then that can also increase your blood pressure. Also, another mechanism through which sodium can increase your blood pressure is that in time, a lot of sodium in our diets can make the lining of our arteries stiffer. So our artery wall is flexible. And when they become stiffer and less flexible, actually we start building up pressure. Think about, I like to use this analogy of, think about pressure at the end of a hose, garden hose that you use to water your plants. The wall is actually stiff. If it was very flexible, you won't have any pressure at the end of the hose. So again, stiffer walls mean more pressure, high pressure, and we don't want that for our arteries. And sodium can do that, can increase your blood volume and can make your arteries stiffer. So through those two mechanisms can increase blood pressure. The DASH diet is something that we recommend for managing blood pressure. It's called Dietary Approaches to Stop Hypertension. That's the acronym DASH. And then basically what it is, it's a less sodium diet. It's low in saturated fat and sugar. It's a more plant-based diet, kind of like Mediterranean diet, with more fruits, vegetables, legumes, whole grains, nuts, and seeds. And less of those saturated fat sugars that are more pro-inflammatory, and less sodium that, again, will affect the blood pressure. So it's been shown with the research studies that can have quite a bit of an effect in reducing blood pressure. And it was pretty close to some medications for blood pressure. So it can be a significant way of managing your blood pressure, this DASH diet. And we're going to talk more about that next week. stages of CKD. Again, the stages are actually determined by the GFR numbers. So the GFR, remember, it's the rate at which the blood is filtered to the kidneys every minute. So glomerular filtration rate, it's actually the rate at which your kidneys or the glomerulus will filter the blood every minute. And it's calculated using a formula. We're not going to get into that. I'm not an expert into how you calculate it, but definitely it uses blood creatinine in the formula, so they're kind of correlated. And the normal GFR ranges between 90 to 120, depending on the individual. So this is kind of normal, and it's considered that you don't have any chronic kidney disease. The stage 1, it's actually kidney damage with normal kidney function. Basically, it's not necessarily chronic kidney disease in the sense that you have 90 or higher % of your kidney function. So kidneys are functioning pretty well. But stage 2, you have some kidney damage with mild loss of kidney function. So usually the GFR is between 60 to 89. So that means it kind of functions at a 60 to 89% capacity. Then stages 3, there are 2 of them, A and B. The A1 is mild to moderate loss of kidney function, GFR between 45 to 59, and then 3B, it's moderate to severe loss of kidney function, 30 to 44. Then we move into stage 4. That's a severe loss of kidney function, 15 to 29% only of functioning. And then stage 5 would be kidney failure. That's usually less than 15% of your kidneys are working at this point to filter. And usually at this point, people are getting ready to start dialysis. So definitely you could see from this slide that the earlier you catch those stages, and with the nutrition therapy and lifestyle changes, and you could actually stop the progression or slow it down to the point that you're not progressing through the kidney failure. The stage 5 CKD options are hemodialysis, peritoneal dialysis that can be done at home, and kidney transplant. And we're not going to address those things. This presentation, it's more like management of CKD and avoiding getting to the stage 5 kidney failure. So I wanted to let you know, because we're not going to have more details about hemodialysis or kidney transplant. Not in this presentation. Ways to prevent and manage CKD. Definitely, because limiting sodium and controlling blood sugar, those would be helpful, since most people will have high blood pressure and diabetes. Increased physical activity, that's definitely helping. Quit smoking and reduce alcohol consumption to 1 drink a day if you're a female, or 2 drinks a day if you're a male. And then modifying diet, and more to come next week. So we're going to talk more about those nutrients of concern with CKD: protein, sodium, phosphorus, and potassium. And we're going to, as I said, dig deeper into the nutrition therapy for that. But those are kind of the main ways to prevent and manage CKD. And I wanted to mention the other ones, not just diet, even though we're going to focus in the upcoming classes on diet mainly, because I know some people also ask, besides diet, what else can I do to protect my kidneys? And I want to make it very clear that managing blood sugar and blood pressure when you have those conditions is paramount, is very important. Benefits of nutrition intervention. I have this article in the Journal of Renal Nutrition since 2016, and I have here the link for who wants to access and read it. But it really shows that medical nutrition therapy has a role in slowing the progression of CKD, delaying the need for dialysis, and improving nutritional biomarkers. So the evidence is there, and it's pretty established. This is a little bit repetitive: sodium, phosphorus, potassium, protein, fluids. More detail next week. Those are the nutrients of concern for CKD and management. Now I want to start talking about the complications of CKD. There are quite a few, as you could see. So gout is one of them. Anemia, metabolic acidosis, secondary hyperparathyroidism, bone disease and high phosphorus, which is also called hyperphosphatemia. Basically, it's higher than normal blood phosphorus. Heart disease, high potassium, also called hyperkalemia, which is again higher levels of potassium in your blood, and fluid buildup or edema, which that also I mentioned that can happen. So we'll start with gout. CKD increases the risk of gout, but also gout can lead to CKD. Or can increase the risk of CKD. About 15% of CKD patients develop gout. And it looks like it's a two-way kind of relationship. And it is because they're both, the uric acid that whoever is familiar with gout, they know that basically gout is a type of arthritis that causes swelling and pain in your joints when uric acid accumulates in your blood. And then uric acid is processed, it's kind of usually ends up in your urine and needs to be eliminated. Again, when you have CKD, you're not doing that properly. That can accumulate more in your blood and create gout. So that's kind of how CKD can lead to gout. But also the gout can lead to CKD. So it's as I said, two-way type of relationship. And the uric acid is made from purine breakdown. And purines are mainly in high protein foods, not always, but it's a component that when you break down those and you metabolize it in your blood, it becomes uric acid. So basically, those very small sharp crystals, they build up around your joints under the skin and cause a lot of pain. People that had gout, they can tell you it's very, very painful when you have those gout attacks. Some people even go to the emergency room and in the hospital just because it's just so painful. It produces swelling and redness, so you could actually see those joints being inflamed, warmth and stiffness. So it's as I said, very painful. How do you manage gout? Avoiding alcohol and foods high in purines will help a lot because, again, the alcohol creates more uric acid when we metabolize it. And then again, the purines, the foods that are high in those compounds, purines, will do the same. Adequate hydration is important, to drink enough water, because again, that can actually help with elimination of uric acid and not make the uric acid as concentrated to create those crystals. Also, you can take medications that are recommended by your doctor. The NSAIDs are part of that, the colchicine and steroids. Ice packs can help to keep the joint cool and just kind of manage the pain. To keep pressure off the affected joint can be helpful, and to elevate the affected joint. So those are kind of ways to manage gout. Gout nutrition therapy, what I like to talk with my patients when I have someone with gout. I just had a patient yesterday that had nutrition counseling with me for gout. So I recommend to avoid the high purine foods, and there are just few of them that are high in purine. And those ideally should be avoided, because some people, even when they eat them once in a while, they might just trigger a gout attack. And again, it's not something you want to do. So things like anchovies, asparagus, animal organs from brains, kidney, liver, and I know a lot of people won't eat necessarily those foods on a regular basis. That's a good the good news. Herring, gravy, dried beans and peas, mackerel, mushrooms, mussels, sardines, scallops. then, you know, some foods, especially the protein foods like meat, fish, chicken, those actually have purines too, but they're not necessarily high. They're more kind of medium purine content type of foods. So with those, we say try to limit the serving. You could still eat them more on a regular basis, but limit the serving to 2 to 3 ounces, which is not as much. About 3 ounces, it's the size of a deck of cards, that thickness and that size, or the size of your palm. That's about 3 ounces. So 2 to 3 ounces can be a deck of cards or a little bit less. So it's not as much, but you could have them more regularly, just limit the amount. Adequate hydration is important too. Again, avoid alcohol, healthy body weight, just because being overweight can actually increase the risk of gout too. And trying to eat regular meals and eat every 4 hours. So avoid fasting, long fasting periods can also help with that. Moving on to the next complication of CKD, and we have anemia. It's common. Anemia is common in people with CKD and usually worsens as CKD worsens. So as your kidney function declines, it's even more common. I mentioned at the beginning with the functions of the kidneys that kidneys make a hormone called erythropoietin. I abbreviated EPO. And that will signal your body to make red blood cells, because I said we need to make red blood cells every 3-4 months or so. Apparently it's 115 days. I have it here. So red blood cells are very important because they carry oxygen through the whole body, you know, so there are those cells in your blood that will carry a lot of oxygen, and this is how our organs and tissues are receiving oxygen. So as kidney function decreases, you may not make enough of this erythropoietin, and then you'll have less red blood cells available to carry oxygen. The symptoms will translate into feeling tired and fatigued and weak, pale skin, dizziness, of loss of concentration. Again, some organs, including your brain, may not get enough oxygen, chest pain, shortness of breath, and intolerance to cold. So those are main symptoms of anemia. And how you manage, well, if you have CKD, because again, anemia can be caused by different things, but in this particular case, we talk about the CKD related anemia. And you need likely erythropoiesis stimulating agents, ESAs, because obviously your kidney are not making the hormone. And you need somehow to stimulate in your body the production of red blood cells. Iron supplements can be actually, again, case by case, the doctor will recommend to take iron supplements. If you're on dialysis, some people get those iron supplements during their treatment. And then some people need to do red blood cell transfusions. So they kind of replenish from a transfusion. Metabolic acidosis. So this is basically when you build up acid in the body. And that has to do with the fact that, again, your kidneys are not keeping that acid alkaline balance that needs to be kept. That's one of its role, right? To keep the blood balance in your body. Symptoms will include feeling tired, weak, nausea, vomiting, decreased appetite, a fast heartbeat, headaches, and even those long, deep breaths. People take those long, deep breaths. The consequences of metabolic acidosis is that it can worsen your CKD. It can increase the risk for osteoporosis. It can lead to muscle loss, endocrine disorders, inflammation. Management, sodium bicarbonate is something that's used, but it's not appropriate for everybody. And some people need to restrict sodium, and then sodium bicarbonate, the name says it has sodium, so it's kind of a sodium based product, you'll have to check with your doctor. So I don't recommend, for anybody to take that unless they check with their doctor. And they're usually pills, medication kind of. And also, there's some evidence that replacing animal-based protein with plant-based protein may lower acid load. And that's because a lot of animal products, when we metabolize and absorb in the blood, and the blood is filtered in your kidneys, will create a more acidic urine, will increase the acidity in your urine. So what happens in our blood, our body needs to maintain a very narrow range of pH. So your blood cannot be too acidic or too alkaline, because otherwise we die, we can live. So our blood needs to be neutral, slightly alkaline. So when we eat something that will create more acidity, like protein, animal foods tend to increase to be more acidic. So in our blood, again, one of the role of the kidneys is to maintain this pH balance, right? So in our blood, our pH is still neutral, very slightly alkaline. But that will mean how your body maintains that is that the kidneys will excrete more of that acid that you've been eating because you ate a lot of meat, and will excrete more of that acid. And that means that your urine is more acidic. The same with, let's say, if you eat too much alkaline foods, which are more plant-based foods, your body will still not become, your blood will still not become alkaline, right? You still have this narrow range of neutral, slightly alkaline, but then your urine will be a little bit more alkaline because that extra alkalinity needs to be excreted. So, as I said, the animal products usually tend to create more an acidic urine, and the plant-based foods more an alkaline. So replacing the animal-based protein with plant-based protein will lower that acid load in your urine. It can potentially help with avoiding this metabolic acidosis. Secondary hyperparathyroidism, SHPT. So this is a condition that happens basically secondary to chronic kidney disease and kidneys kind of decreasing ability to regulate this hormone. So what happens is this, I'll kind of need to break it down so it's not confusing. So parathyroid, those are like 4 tiny glands that are kind of located on your thyroid. So the role hyper means that you're producing too much of this hormone, which we call PTH, parathyroid hormone. So this hormone is secreted by the parathyroid glands, and its role is actually to maintain the calcium phosphorus balance in your body. So healthy kidneys, they activate vitamin D, the way I said, that's one of the roles. That increases the calcium absorption from the foods we're eating. And that keeps the calcium phosphorus balance in our body. Now, with the decreased kidney function, you cannot activate vitamin D. You have low vitamin D, and then that means you cannot absorb that much calcium. You have low calcium. And that will trigger to increase this parathyroid hormone secretion, because what this parathyroid hormone does is it pulls calcium from your bones to increase the blood calcium. And I want to explain something because I hear that quite often from my patients. They say, let's say I'm assessing their diets and I'm looking how much calcium they're getting in their diet from foods and supplements. And they say, oh no, I think I'm fine, even if I'm not eating, let's say, dairy products, but my calcium was fine because I did a blood test. And I want you to know that the blood calcium is not a good, it's not actually a good measurement of you eating adequate calcium from your diet or supplements. Calcium is a very important mineral in our body because it's involved in muscle contraction, and our heart is a muscle that contracts every single second. So what we need to understand is that if we don't eat enough calcium from foods or supplements, our body will break down bones, because that's the main source of calcium in our body, to make sure that we have adequate blood levels of calcium. Again, the calcium will be out of whack, either low or high, when those systems are not working properly, like in chronic kidney disease, in the secondary hyperparathyroidism. So, but in the normal individual, regardless if you eat adequate calcium or not, your blood calcium will be likely normal. But your bones may suffer because, again, your body will compensate by breaking down the bone mass. So in this particular case, the secondary hyperparathyroidism is this basically oversecretion of this hormone because of the kidneys not working properly. They would actually pull calcium out of your bones to increase blood calcium. And that definitely increases the risk of osteoporosis and bone disease. So symptoms will be osteoporosis, bone joint pain, kidney stones, urinated more often, loss of appetite, feeling weak. And the management is like, you want to take vitamin D and calcium supplements to help with the calcium absorption. There are also some calcium mimetics, which basically they mimic calcium. So they're telling your parathyroid gland to make less of the parathyroid hormone, because remember, low calcium kind of secretes more of this hormone to pull calcium out of bone. So those calcium mimetics can basically tell your gland, don't make this hormone, we don't need it. And then dialysis and kidney transplant, of course, can be options because you know, they can actually help with regulating the system that's kind of broken down at this point. Bone disease and hyperphosphatemia, this is a little bit repetitive in a way. I mentioned that one of the roles of kidneys is maintaining this electrolyte balance, and phosphorus is one of those electrolytes. And when the kidneys are not working properly to filter properly our blood, actually the phosphorus can accumulate in our blood, cannot get excreted properly. And that can lead to hyperphosphatemia, which means higher than normal blood phosphorus. Again, when the kidney function decreases, more phosphorus accumulates, then you have a low vitamin D and low calcium, and that increases the secretion of this parathyroid hormone, and then you get more calcium out of your bones and you develop bone disease. So it's a little bit connected with the previous slide, but I wanted to make you aware of sources of phosphorus in your diet. I mean, those can be foods, drinks, or medications. Some medication has phosphates. Foods can have phosphates, naturally occurring phosphates, and actually added phosphate additives, what we call, in processed foods. And usually, I just realized I misspelled meat with meta. I apologize for that, but usually protein foods, high protein foods, are high in phosphorus. A lot of times when we're limiting the protein intake to manage CKD, we're actually limiting the phosphorus, which is nice because we kind of shoot two birds with one stone. So protein foods like chicken, meat, fish, nuts, beans, milk, and cheese, those are your main sources of phosphorus, but also things like wheat bran, so whole wheat products, those can also have more phosphorus. For drinks, we have dark color sodas, cocoa, chocolate kind of related drinks, beer, milk, instant tea. And somebody asked about unsweetened iced tea, if that's a good option for somebody with CKD. And I wanted to ask because tea by itself, naturally, let's say when you brew tea, green tea, black tea, herbal tea, it doesn't have naturally phosphorus, but a lot of the instant iced teas, you know, those powder, those have those phosphate additives. And that's why those should not be consumed. But let's say if you brew your own tea and you cool it in the fridge, you know, you could have iced tea this way that doesn't have a lot of phosphorus. And then medications too. Again, some medications we have as phosphate. A good way to look when you read the ingredient list of a food, of a medication, when you see words with phos, you know, phosphate, phos, I mean, that's basically phosphorus. And that kind of gives you an idea if you have those phosphate additives. And we're gonna actually touch upon that and get more details next week. Bone disease and hyperphosphatemia continue with the management of it. Well, you want to limit when you have higher phosphorus than normal. At this point, you probably need to limit the phosphorus you eat and drink. In general, depending on the stages, and again, I'll actually go in more detail next week, but I don't limit phosphorus for someone that's stage 3 or even 4, that they have normal phosphorus lab values, because especially you notice a lot of phosphorus foods are healthy foods like beans and nuts and whole grains, and then also the protein foods. So you don't want to limit. I start talking with people about limiting processed foods and those phosphate additives, because they're also highly absorbable compared with natural phosphorus in foods. So you absorb them much better. So I start there for dietary restrictions, and I don't limit those healthy foods basically. But at one point, depending if your levels are high, you might have to watch and limit also the ones that are more naturally sources of phosphorus. Again, you want to pay attention to phosphate additives in foods mainly. A lot of times doctors will prescribe phosphate binders to take with your meals, and the role is actually to bind this phosphate that you're eating, and you kind of get it excreted in your colon, and it doesn't get absorbed in your blood. Also take a calcitriol supplement. This is an active form of vitamin D. It can help increase calcium absorption in your intestines. And that can actually help with that balance that I've been mentioning. And then exercise daily. Apparently exercise helps you get rid of phosphorus from your body more easily. Heart disease, CKD increases the risk of heart disease, but also heart disease increases the risk of CKD. And the kind of the heart and the kidneys are working together here, and they can influence each other basically. When one is not working properly, the other one can actually suffer. Complications of CKD can increase the risk of heart disease. So on top of just CKD, also the complications of CKD can increase the heart disease risk. And those are anemia, high blood pressure, high homocysteine levels, and unbalanced phosphorus and calcium levels. So all those are actually adding as risk factors for heart disease. So what do you want to do? You want to manage your weight, your blood glucose, your cholesterol, your blood pressure, this balance of phosphorus, calcium. You want to follow a heart healthy diet that's low saturated fat and low sugar, a more plant-based kind of Mediterranean diet pattern, and we'll talk more next time, higher in fiber. You want to watch your sodium in your diet, because that, blood pressure, and that can increase the risk of heart disease. Exercise regularly, manage stress, and take the medication as prescribed. The high potassium, which is hyperkalemia, when potassium accumulates in your blood. So potassium is also a mineral and electrolyte that your kidneys are regulating, and it's also involved in muscle contraction. Just kind of like calcium. As the kidney function declines, potassium accumulates. And the symptoms can be you're feeling tired and weak and nauseated, you have muscle pain and cramps, and unusual heartbeat, because high potassium, but also low potassium too, they both can cause arrhythmia and can actually lead to a heart attack and death. So it's a kind of a life-threatening type of situation. So when your potassium is too high, oftentimes, like if you do labs with your physician and they see levels of probably around 6, which is pretty high, they may ask you to go to the emergency room, because you could have a heart attack anytime. So it's very dangerous. trouble breathing and just chest pain. So those are other symptoms, but the idea how you manage, definitely it's good to do regular labs because then you could catch those higher levels of potassium. But if your potassium is higher than normal, then you want to do a low potassium diet and also take some medications, which are potassium binders, the way we have the phosphorus binders. Another thing I want to mention, and we'll talk more next week about the potassium, low potassium. Again, if I have someone with CKD, stage 3, even 4, that does not have hyperkalemia, high potassium, I don't restrict those healthy high potassium foods that a lot of times are plant-based foods, and they're part of a healthy kidney diet. But I want people to be aware of those high potassium foods. And if, again, the labs are becoming, or the numbers are creeping up, we could monitor and cut back. And I like to work with them to give options. I mean, still eat fruits and vegetables, but focus more on the ones that are lower in potassium. I think this is my last slide, and then we can take questions, and we're gonna have quite a bit of time for that. Fluid buildup or edema. So again, remember the kidneys are responsible to eliminate waste and fluid, extra fluid that our body doesn't need to recycle back into the blood. As the kidney function declines, the extra fluid accumulates in the body, so the kidney cannot eliminate that, and then that can increase blood pressure, and it can put more strain on your heart and lungs and create actually problems, heart disease and lung problems. Symptoms are like faster heartbeat, swelling in your feet and ankles. So those are the main symptoms of fluid buildup. And the management is sometimes, depending on your stage, and this is usually with more advanced stages that happens, that you need to have a fluid restriction. You kind of have to track your fluid intake. Your doctor will recommend, like, sometimes it's let's say 1,500 milliliters of, which is 1.5 liter or 1.5 quart of fluid a day only. So you can't really drink more than that. And with that, if you need to track your fluid intake, it's good to remember that certain foods like soups or ice cream popsicle can count as fluid, and sometimes people don't think of that. They eat a soup for lunch and they don't track that as fluid. Low sodium diet helps a bit, quite a bit, to manage the edema, because as I mentioned, salt can make your body hold on to the fluid. So I always say the water likes the salt. Kind of stays where you eat more salt, the water stays more into your body where the salt is. And there are also medications like diuretics, water pills that doctors sometimes need to prescribe for fluid buildup management. And with that, actually, I'm going to conclude today's presentation.
Hi, thank you so much. Great information. Let's see. You were mentioning that the blood test for the calcium measurement isn't the best one to have to find out about the calcium. What test or tests would you recommend?
Well, I was saying, and I want to clarify, it's not a good test to assess if you're eating adequately calcium in your diet.
Oh, okay.
So a lot of times is that, again, we might not eat enough calcium, but our body compensates by taking more from the bones. So then your level of calcium in your blood is normal, but that doesn't mean you may eat enough calcium. And then with that, okay, I would say DEXA, doing DEXA scans and looking at bone density, that will tell you actually is like, oh, okay, maybe,
yeah. Okay.
Yeah.
Yeah. Okay. Thank you. Very clear. Thank you very much.
You're welcome.
Elena, we have a question here in the chat. This participant wrote, well, first they wanted to say this was very informative, and they later asked, I have had acute kidney disease, blood/urine parameters are almost back to normal, and hope you review what a healthy kidney diet would look like. You mentioned DASH. Is that the best diet to follow?
Yeah, so I would say, especially with an acute kidney injury, and now you have a recovery, because in certain cases, the kidney function does not recover quite well, unfortunately, but in many cases it does. So now basically, I think definitely a DASH diet / Mediterranean diet, which both are more plant-based diets. Doesn't mean you need to become vegan or vegetarian unless you choose, but you don't have to. This plant-based diet umbrella means that when you look at the majority of foods that you're eating in a week, 80–90% of the time, the majority of those foods that you're eating in a week are coming from plant foods. So for example, I like to use the My Plate method, and I say, well, 80–90% of your meals in a week, that means 1 or 2 maybe can be outside of this pattern, can be the exceptions. I don't know, you eat out, you might go to a party, not as often now with COVID, but you don't have to stress over what I'm trying to say. You don't have to stress over every single meal you're having, but the pattern is what you do majority of time. In majority of time, your plate should look like maybe about half of the plate vegetables, non-starchy vegetables, and the other half should be the starch and the protein. So a quarter of a plate the starch, a quarter of a plate protein, and about half vegetables, and that would be ideal. In this way, about 3/4 of your plate will be plant-based, will be coming from plants, and then just a quarter animal. So this is the definition of plant-based. And if you do this 80–90% of the time, this is a diet that's anti-inflammatory. It's not produce a lot of acidity in your urine. It's healthy for your heart. It does not produce a gout attack, because usually the high protein foods and alcohol, and those are triggers. So it's really, and because you focus on those plant-based foods that are having these anti-inflammatory properties, you keep the inflammation at bay. And inflammation in our body is the root at most chronic diseases in our society, including diabetes, cardiovascular disease, cancer. So it's definitely healthy for stages of CKD that are not requiring any restrictions yet. And then also, especially for, in your case, you recover your kidney function, you had this acute kidney injury. I mean, this is, yeah, I would continue for health with this diet.
The person also wanted to follow up with that. Should dairy be avoided, such as cheese, milk, cream, sour cream, yogurt?
Yeah, so dairy, I mean, those are animal products, and a lot of, like, when they are in the full fat, we're consuming them in the full fat versions, they're high in saturated fat, which is a more pro-inflammatory type of nutrient. So usually for that quarter of a plate protein, right, that we were talking about, the low-fat, non-fat dairy products are good options. The high-fat ones, we still want to limit, So for example, the cream, the sour cream, the cheeses, those can be limited. And it's all about like how much you're consuming, because we all have a budget for saturated fat, even when we're trying to eat less. Let's say we're trying to manage our cholesterol. I mean, everybody still has room for about 15 grams of saturated fat in a day, on average. I'm just estimating because it's based on calorie needs, but let's say an average person will need about 15 grams of saturated fat. I mean, not to need, but you could still have that on a low saturated fat diet. So if you have a budget for saturated fat, so if you consume that or use that budget, let's say I really like cheese, I need to limit to 1 ounce, because if I'm eating 3 ounces of cheese every day, I might actually go over that budget. Depending on what other foods you're eating, if you're more vegetarian, 1 or 2 ounces of cheese, it's appropriate for you in a day. If you like also chicken meat to eat, then I would keep it maybe to 1 ounce. Cream and sour cream will be, or half and half, would be higher in saturated fat than cheese. So those I would limit even more. And then again, with yogurt and milk, you could choose a low fat, non-fat options. So then you kind of manage that budget. But the dairy products can be part of a healthy diet. It's just to monitor the saturated fat. You're muted, Twin.
Thank you. Now why don't we turn to the list of questions that came in through the registration. Have you highlighted any that you wanted to talk about first, either Patty or Elena?
Yeah, so I'll do some that are kind of easier to answer. Some were not as clear as I wanted. So for example, somebody said transplant questions. And I'm not clear like what transplant questions. And also I mentioned that unfortunately this presentation is not for transplant. We're not going to address that today. I feel like if you need more information about transplant, I think maybe Patty could send you some resources that you could get that information, because unfortunately with this class series, we're not going to address those. Somebody had a question about nutrient absorption. For example, said if pasta and vegetables, broccoli, carrots, beets, sweet potatoes are boiled in salt water, and the person was specific with a quarter of a teaspoon of salt in 24 ounces of water. The person was wondering how much of the salt is absorbed by the food. And this is a tough question in a way, because I could tell you definitely some salt will be absorbed into the food, but it's not clear in terms of research or information of like how much, you know. There was actually found an article about saying that up to 3%, which is not much when you put a quarter teaspoon of salt, but in the study, they used like a quarter of a cup of salt in more water, and the 3% was still kind of maybe about 800 milligrams of sodium, so quite a bit. But I think it will depend on the absorbability of each product. Like pasta may be less absorbable than a vegetable. You know, if something is more porous, will absorb more. I think it's not clear. It's not going to be well determined unless you have a lab and you test that in the lab. So we don't know how much you absorb, but we know you absorb salt. So when you're really limiting the salt, you have to ask yourself, do I really need to put salt in my boiling water? Why do I add salt in my boiling water? You know, some people add salt in the boiling water because they think the pasta cooks faster. In reality, a salty water will increase the temperature of boiling just maybe with 1 degree Celsius. So it's kind of more like a myth. So if you add it for that particular reason, I won't add it. Again, if you add it for the flavor, the question is, can you flavor that vegetable in a different way? So when you are really trying to restrict sodium for health reasons, if that particular habit of boiling the vegetables or the pasta and salty water is not necessarily needed, I won't do it because I can't tell you how much you absorb. The next question was how much water to drink daily. You know, 8 to 10 cups of fluid, depending who you are, 8 to 12 cups of fluid. I mean, depending also on your activity level. We say in general 8 cups of fluid a day, and then fluid again can be also juice and milk and soup and water, not just water. We want at least half of it to come from water, just because in this way we minimize calories, we minimize sugar and other things that will come with the fluids we're drinking. So at least half ideally would be water. But when we talk about fluid intake, we put everything together, not just the water. I wanted to make it clear. So 8 cups would be kind of a basic recommendation. Again, it can be more, especially if somebody it's larger frame, taller, heavier, if they exercise a lot and sweat, or let's say they have GI issues and they vomit or the diarrhea, they need to, you know, they need to drink actually more to keep the hydration up. I answered the question with unsweetened iced tea, if it's okay to drink. So instant ones, not as good, but the fresh tea that which you brew, it's okay. Is low protein diet important for those with CKD? We're gonna talk more in detail next week about that. And then the protein restriction seems to definitely help to not put extra strain on your kidneys.
Thank you.
Thank you.
Thank you. Thank you, everyone.
Thank you.
See you all next week. Bye.
Yeah.
Bye.
Bye. Thank you.